The wheelchair assessment process is a multifaceted process which involves the therapist becoming much like a police detective, collecting both subjective and objective information about the person, including their mobility needs, their environment, their functional abilities, the level of postural support they require, and any skin issues they may have, in order to gain a full picture of the person's needs. In order to gain this information, the following components are included in the assessment process. 1. The initial interview. 2. Postural analysis, while seated in their existing seating system, if the individual has one. 3. Mat evaluation on a plinth. The initial interview is an essential component of the assessment process. Generally, the first step, the clinician asks a range of questions, which helps guide their clinical decision-making process as the assessment progresses. One of the most important questions, however, is what do they want to be able to do with their wheelchair? What are their aims or goals? Observe how the person sits in their existing wheelchair. What do you see? What do they complain of? Sliding forward, for example. What is their posture like? Do they sit straight in the chair, i.e. symmetrical? Are any of the following common postural presentations present? Posterior pelvic tilt and kyphosis, anterior pelvic tilt and lordosis, pelvic obliquity and scoliosis, hip rotation, hip adduction, hip abduction, wind sweeping. Ask the person to sit upright. Check to see if they're sitting as far back in the wheelchair as possible. Ask them to lean forward or with assistance to see if the posterior pelvis contacts the back support. Locate the anterior superior iliac spines, ASIS, at the front of the pelvis using your thumbs. These feel like bumps located around where your belt would be if you were wearing one. Check if they're level. Assess hip movement with your hands cupped around the pelvis. Attempt to move the pelvis anteriorly, forward, and posteriorly, backwards. Assess how much flexibility they have when seated. Assess knee range of motion. Locate the hamstring muscles behind the knee. Extend the lower leg whilst keeping your fingers on the hamstrings and feel for any tightness. Also look at the pelvis. Does their pelvis move when you do this? Assess ankle range of motion, supporting the lower leg move, the ankle joint, pushing the toes down towards the floor, dorsiflexion, and then bring the toes up towards the ceiling, plantar flexion. Move the foot in the way and out the way, inversion and eversion, to determine whether the foot can be supported by a standard footrest. Assess for spinal curvatures. Stand either in front of the individual or behind them. Are their shoulders level? If one is higher than the other, this could indicate they have a scoliosis. Stand behind the individual. Look down at their shoulders to see if they're in a straight line. If one shoulder is more forward than the other, this may indicate spinal rotation. Ask the person to lean forward and lift their top up slightly. Have a look at the spine. Feel for the spinous processes to help detect any curvature. Asking the user to lean forward or with support as needed will also give you an indication of spinal flexibility. Whilst doing this, check if the user's back looks symmetrical or if there is rib humping, one side of the back more prominent than the other. This can also indicate scoliosis. All too often, this component of the assessment process is skipped. Getting the person out of the wheelchair, however, provides critical information about the person, including their transfer ability, sitting balance, and range of motion, whether their posture is fixed or flexible. Transfer ability. Can they do this independently? How do they transfer themselves? Is it safe? Is further training required? Sitting balance. To fully assess someone's sitting balance, it's essential to do this on the plinth. Ask the person to sit over the edge of the plinth with their feet on the floor or supported, so they have roughly a 90-degree angle at their hip. Next, ask them to raise both hands up off the support surface. From this, you'll be able to see if they are A. a hands-free sitter, B. hand-dependent sitter, or C. a prop sitter. When the person has transferred from a sitting to a lying position, firstly, take a few minutes to look at how they lie on the plinth. This may already give you some indication as to whether they have fixed range of motion in their pelvis and spine, or if their posture is flexible. To start, ensure the pelvis is in a neutral tilt by locating the ASIS at the front of the pelvis and ensuring they're level on the horizontal plane. Level the shoulders so that both acromial processes are level on the horizontal plane. If the shoulders cannot be leveled, the spine may not be flexible enough to permit symmetrical sitting. Support the user's leg or legs. Flex the hips towards the user's chest so that their hamstring muscles relax. Then extend the lower leg so that it's horizontal to the plinth or support surface. End joint range of motion can be felt when the pelvis starts to rotate posteriorly or backwards, or the coccyx can be seen lifting off the plinth. If the hip can be flexed to approximately 90 degrees, this is sufficient for a standard seat-to-back angle on the chair. If not, an angle-adjustable back support or reclining back support will be required to accommodate the hip angle. Repeat this process with the other hip. Flex the hips to as close to 90 degrees as possible, and then extend the knee as much as possible. If the knee cannot be extended with the hips flexed, then the hanger angle will need to be set to an appropriate angle for the user. Depth adjustable footrests may also be beneficial. Check if the ankle can be dorsiflexed to a right angle when the knee is flexed. If the ankle is able to bend, then the foot can be positioned on a standard footrest. If not, an angle adjustable footrest will be required.